Good morning, ladies and gentlemen, and welcome to this meeting of the Scrutiny and Performance Committee of Perth and Kinross Council of Wednesday, the 19th of November 2025. My name is Colin Stewart. I'm the convener of the committee. I'm joined by Bailey Alistair Bailey, the vice convener, by Ms Molly, clerk to the committee, and by Sarah Roger on behalf of legal and governance. Are there any apologies or substitutions, clerk?
Thank you, convener. We have no formal apologies this morning. I think we have Councillor Frampton joining us online. Can I just check that Councillor Frampton is in the meeting?
I'm present.
Thank you. All other members are present in the Chamber's, convener.
Thank you very much. Members, are there any declarations of interest in items on the agenda before us today? Not seeing any declarations of interest, so we'll move on to the minute of the meeting of the Scrutiny and Performance Committee of 17th of September. For approval, members, can we agree the minutes of the last meeting? Thank you very much. Members, the next item on the agenda is the outstanding business statement. Can we note that all that items on the outstanding business statement have been completed, and can we remove them from the outstanding business statement? Agreed. Thank you. So our first substantive item then is the current financial position of the three ALIOs, that's arm's length external organisations, but we'll go with ALIOs from here on. I think we don't have anybody in the chamber, so joining us online we have from Culture Perth and Kinross, Kenny McWilliams, their Head of Operations and Support Services, from Live Active Leisure, Paul Cromwell, the Chief Executive, and from Perth Theatre and Concert Hall, Darren Campbell, the Head of Commercial, and joining us in the chamber we've got Karen Johnson and Steve MacDonald. So members, we've got those current financial positions. Have we got any questions? Councillor Forbes.
Yeah, thanks, convener. Sorry, bear with me. So the first line on the Culture Perth and Kinross relates to donations and legacies. I just wondered how you predict what that income is likely to be. It feels to me it's probably quite a difficult thing to do.
Do we have Mr. McWilliams?
Yeah, good morning, convener. Thank you for the question. Yes, the initial analysis is entirely correct. It is difficult in terms of, particularly for legacy gift giving. There are a number of processes that we do go through in terms of trying to get donation income and increase that donation income. We also do a lot of benchmarking against our comparator organisations as to how we do that, and we put strategies in place in order to develop how we create our income generation through those donations. So it's not an exact science, but there are always estimates and benchmarking that we work towards in terms of how we estimate how we get our legacy gift giving and donation income.
Councillor Allen.
Thank you, convener. I've got two questions. I'll take the first one because it basically goes to the three parties really. It's in understanding the seasonality and how ticket prices can vary from summer to winter and to Christmas time, etc. I'm just wondering what the plans are to close the gap where there are significant gaps. Thank you.
Okay, thank you. Shall we go to, we'll go to Kenny McWilliam, I think, from Culture Perth and Kinross first, and then we'll go to Mr. Campbell from Perth Theatre and Concert Hall, and then I understand actually that Mr. Cromwell isn't available, so we'll go to Karen Johnson for Live Active Leisure third. Okay, Mr. McWilliam.
Thank you, convener. In terms of seasonality of ticketing, particularly for Culture Perth and Kinross, and for Perth Museum in particular, and Perth Art Gallery, exhibitions have very different audiences during the summer, so the tourist market is hugely important to us. So the summer season attracts a different and actually a larger proportion of our audiences. So that's when we tend to do a much more broad reach in terms of our programming. And then during the winter months, we then target the local audiences. So there is a reflection in terms of how we put together our exhibitions and our activities and events to relate to both the local and the tourist market as the seasons change.
Okay, thank you. And Mr. Campbell?
Hello, thank you for the question. And to the point about seasonality, when we enter into this time of year, there's a pretty substantial expenditure for preparing for things like Panto season. So in addition to the summary that Chris has sent in with the papers for scrutiny, we would typically see a bigger outlay for that at this time of year. So while the deficit we have certainly is a little bit more challenging given ticket sales in the current environment this year, it's not to be unexpected. Last year we did have 100,000 grant from the Wolfson, which does make our year-over-year numbers look a little bit askint, but purely just from that singular hit that we had in August. As far as future plans, based off the ALIO recommendations, we've taken on internal work for workforce planning across all of the teams in the organization, and in order to look for more efficiencies and ways to drive revenue. There is major funding work that we've put forward for the Scottish Government, up to £300,000 in applications for major funding and pending responses for some of those. We've also launched a refresh monthly donation campaign supported by enhanced lobbying efforts locally and nationally. And the last point, we're working to reduce recurring freelance production costs and selling surplus administrative and technical equipment to improve operational efficiency. So those are the 4 points where we think we could probably find most gains to mitigate the deficit through driving revenue in this next quarter.
Thank you for the question. For Live Active Leisure, I would say it's potentially less relevant for them. They do have many different marketing campaigns throughout the year, but the gap is predominantly as per their narrative about the swimming, and they do have annual price reviews with regard to that. But potentially less relevant with all the different ticketing prices that there are for Perth Theatre and Concert Hall and CBK. Thank you.
Thank you for your answers. I've got two follow-ups to Perth Theatre and Concert Hall. You mentioned there about submitting a major funding bid to the Scottish Government for £300,000. Have you any idea what the prospect of this is of being successful? And also your fourth point about reducing recurring freelance production costs and selling surplus administration, technical equipment, etc. Have we got previous experience of this, and what kind of success do you expect from it? Thank you.
Yes, thank you for the follow-up questions. To the first point, I probably can't speak to that as specifically because Chris is tied more in with the development funding. My job function sits in a slightly different part of the trading revenues, so I'm afraid I don't have a specific answer for you there. But the applications that we have are within what would typically apply to arts organizations in our situation, and we're hopeful that that would be something that we would be applicable for. As far as reducing the freelance production costs, to give some examples, we've looked into the way that we staff Panto, which obviously is our biggest sales driving program as far as ticket sales, but then also the biggest cost that we have for putting on annually. Oftentimes there are duplicates that are put in place for freelance positions to make sure that we have enough staff should winter bugs come through or things. You're talking about a production that has 46 performances as well over the course of 2 months worth of work. So we're looking to streamline that as much as we can. And then when it comes down to technical equipment, when we received the Wolfson grant last year that allowed us to upgrade the lighting rig for the concert hall. That previous system that we have is essentially backup for us and or equipment that we can look to sell off, which we're not using. So we do have some experience in that. We have people within the trade that we can go to for those bits and pieces. As far as quantifying the impact of that at the moment, probably difficult to say, but we're working through the process to offload some things rather than necessarily save them just for if we might use them in the future. Thank you.
Thank you. Councillor Forbes, you're next in the chat.
Thanks. Two questions related to each other. Page 16 of the supporting commentary it says the pay award was 4% compared to 3%. And my first question is who agreed to that increase, or who agreed the differential? And my second question is a wider question to all three. It's really just for my own clarity. The national insurance increase, I think the UK government covered the cost of that for local authorities, but did they cover it for ALIOs as well?
So Mr. McWilliam first, I think.
Thank you for the question. Just to clarify, the 4% increase Culture Perth and Kinross is tied to the Perth and Kinross Council pay award and conditions. So we match the 4% increase that Perth and Kinross Council and COSLA agreed. So that's where the 4% comes from. In terms of the national insurance contributions, I understand that our national insurance contributions were part of our service fee for this year, as included within the service fee from Perth and Kinross Council. Thank you.
Thank you. A quick follow-up, Councillor Forbes.
I'm not sure there's anyone in the room that can answer this. And does that mean that national insurance contribution came from Perth and Kinross budget, or did it come from the government to Perth and Kinross and then to the ALIOs?
Ms Johnson.
Thank you. The award that was given last year to CPK, the additional 500,000 per year for 2 years, that included it for Culture Perth and Kinross, but there's been a contribution made to Live Active Leisure and Perth Theatre and Concert Hall separately. So they have received a contribution towards it. But CPK's was rolled up into the 500k. Thank you.
Thanks for that. So I'm trying to get to the source of that money. Did that money come to PKC from the UK government, or did it just come out of our money?
I can find that out for you. It came via Mr. Walker, Head of Finance. I can get that information for you though. Thank you.
Councillor Smith.
Thank you very much, Convener. My question would be towards Live Active Leisure. I'm looking at the income, etc. I'm looking for the future here. We just seem to be bouncing along with the same old, same old. I'd like to know what the future looks for this Live Active Leisure as regarding, are we looking towards other sports, incorporating them in towards, for instance, in towards PH2O? We can get stale with the same old football, the same old this, the same old that. So is there anything in the future for some income in other sports? Thank you.
Hi, Steve McDonald, Economic Development Manager, Business Place and Investment. So I don't want to speak on behalf of Live Active Leisure because they're obviously not here today. But I suppose be assured that Karen and I have met with them certainly a couple of times recently to look at the provision and look at where there's opportunities for rising participation across a number of different sports and physical activity. So that work is ongoing, but we can certainly get Live Active Leisure to report back maybe at a future scrutiny committee a bit more detail on that, but those conversations are happening.
Thank you. Councillor Shires.
Thank you, Convener. My question's for Perth Theatre and Concert Hall, and it's in the commentary section under fundraising and sponsorship, and it talks about enhancing our Friends regular giving scheme and looking to attract higher value donors. My question really is around the expectation within the community that we have enough people to target across Culture Perth and Kinross and Perth Theatre and Concert Hall, and whether there's ever been any consideration to a kind of dual support from people who might be lucky enough to have the kind of level of income, or businesses that might support across that cultural offer. But it just looked to me like that could be quite a vulnerable section if both alios were chasing after the same market.
Thank you. Mr. Campbell, do you want to come in on that?
Yes, thank you for the question. I think it's a valid one. The Friends scheme certainly for us is a part of multiple aspects of fundraising and sponsorship for the organization. You know, compared to some of the major trusts and grants and things that we receive, it's certainly a much smaller portion, but it feeds into those that are loyal followers of either the theatre or the concert hall programs. I think to your point about working across, you know, the other ALIO members and some of the recommendations that came out of the recent ALIO review, that's a fair point and something for us to consider taking up with CPK. To your question about whether or not that maybe is a risk, or if it dilutes, you know, the ability to gain an income from that because we're both going after the same audiences, I think I would probably need a little bit more information sharing with CPK, you know, to dig into the types of donors that they're receiving for those programs versus ours, and see if they really are similar audiences or different, or if it's larger funders within the Perth and Kinross community that do participate across all the different aspects of arts organizations. Thank you.
Okay, thank you. And I think probably just as Mr. Campbell's mentioned, the recent ALIO review that we agreed at Council last month, come the next time that we've got the 3 ALIOs in person with the chief executives here in, which I think is our next meeting, we'll probably want to dig into the arrangements about the strategic partnership and how that's operating and how that's anticipated in future. Okay, Councillor Forbes, you've got another one.
Last question, you'll be pleased to hear. I thought Councillor Shires was about to ask it because it's in exactly the same paragraph, but it's relating to something different. It's so it's for Perth Theatre and Concert Hall, and it's in regard to the maintenance that you had to do, and you said July and August were particularly quiet for conferences because of this. So I'm wondering if you planned the maintenance around a quiet period, or if you had to turn away any conference business, and if you did have to do so, can you give us an approximate value of the business you had to turn away?
Mr. Campbell?
Yes, thank you for the question. We have 2 annual maintenance periods, the larger of which is actually in January. So going into the second week of January, we have a 2-week period where our staff work through both venues to do all the required annual testing and maintenance work, bring in some external contractors for Lawler work and other things. The July one is typically a bit smaller, doesn't require things on the same scale, and typically lasts for about 1 week. It is intentionally picked for that time of year based on the quietest level of programming, as is January. And off the top of my head, I probably am not able to say if we turned away any conference business, but certainly when booking things, we typically don't receive requests for July. To give an example, peak seasons for conference and events is where we are currently, October, November, and the first week of December, and followed shortly by March and April. But that's been strategically the history of the theatre and concert hall to avoid a time of year when we would be losing revenue for that potentially. Thank you.
Thank you. And maybe I'm not seeing any other questions in the chat. So maybe just a follow-up question from me to Councillor Allen's, one of Councillor Allen's questions about Live Active Leisure's financial position. It was just, I think we heard that there wasn't seasonality in there, so much seasonality in their ticketing and bookings as for Culture Perth Kinross and certainly for Perth Theatre and Concert Hall. But if I'm understanding the financial statements correctly, Live Active Leisure have a similar £150,000 versus budget gap, and I just wondered what. I just wanted to be reassured that they've got plans in place to address that before the end of the year.
Yes, thank you, convener. As per the narrative, the gap is mainly from swimming, and they do certainly have plans to address that. I can get more information on that for you if you would wish. Thank you.
Thank you very much. Okay, so I'm not seeing any further questions from members. So thank you very much, Mr. McWilling and Mr. Campbell for attending, and Mr. MacDonald and Mr. Robertson as well. Thank you. We'll move then on to the item 6 on the agenda, which is the Council Complaints Performance Report for 24-25. And I think it's Mr. Wilson who's going to introduce this report, who's Business Support Service Manager. Mr. Wilson.
Good morning. Thank you, convener. This report details how the council is performing in relation to the handling of complaints for the financial year 24-25. Our aim is to ensure transparency, accountability and continuous improvement. Some key messages for committee from this report. From April 2024, we created a dedicated complaints team, which now leads on stage 2 investigation and supports frontline staff, ensuring a faster, more consistent responses. We've introduced a revised training programme, e-learning module and practical toolkit to strengthen staff confidence and capability. In the report this year, as detailed in section 4, we've placed clearer emphasis on our continuous improvement and understanding of complaint trends, and work continues within this area. Crucially, we've developed dashboards and strategic business intelligence reports. These were piloted during this reporting year and rolled out from April of this year. This new insight allows services to highlight areas of concern, reduce repeat complaints and deliver proactive improvements, making our complaints process not just reactive, but a driver for better customer outcomes. The report details our improved performance. During the reporting year, we received 1,604 complaints, which is a 19% reduction on the previous year. Of these, 1,492 were closed, demonstrating strong progress in managing our cases effectively. I'm also pleased to report faster response times, as detailed in section 3 of the report. Stage 1 complaints were resolved in an average of 5.8 days, which was down from 6.1 days. And stage 2 complaints in 20 days, down from the previously 28 days. So this is a significant improvement compared to the last financial year and reflects the hard work of our teams handling the stage 1 complaints and the benefits of having a dedicated complaints team. In section 5, I've detailed a small sample of our learning, service improvement and recurring themes. We delivered 290 service improvements directly as a result of complaints, covering areas such as adjustments to processes, staff training, clearer communication, and better consultation with our customers. We have a good relationship with the Scottish Public Service Ombudsman, and I'm pleased to report that during this reporting period, no complaints were investigated by the Ombudsman and no recommendations were issued to the Council. This reflects the robustness of our approach and our processes. Further details can be found in Appendix 2. Finally, I want to reassure committee that we have a robust and effective complaints handling procedure in place, which is aligned with the Ombudsman's requirements. It's regularly reviewed and focuses on fairness and transparency. Thank you for your time and happy to take any questions that members may have.
Thanks, Mr. Wilson. Councillor Forbes, you're first with a question.
Yeah, thanks, convener. I wonder if Mr. Wilson might be willing to pull the microphone a little bit closer, because I was struggling to hear him there. I have a few questions. Convener, you'll understand what I'm about to say, that being an elected member is a little bit like being a doctor. Nobody comes to us to say everything's great and they're very happy. So we have a little bit of an insight into the complaints process and how that plays out. So I'm wondering what facilities or services the council have in place for the staff who have to deal with complaints, because I would imagine it's a very difficult process to go through and maybe demanding on their mental health.
Stage 1 complaints, the complaints team support the officers, so they're regularly checking in with them to see where they're at with it, see if they need any help around key phrases for responding to that, and making sure they're able to do it within the 5 days or the 10 working days. The stage 2 cases, which are dealt with by central teams, they're a small team, they work closely together. They have training on trauma approach, for example, through the council. They have various support that they can access through the health and wellbeing if that's required. There are some cases which obviously are complex that they're dealing with and have a personal impact upon them, but they have support there to do it, and they are trained and they have the right tools to be able to take that forward.
Sorry, I thought there was multiple. Oh, all right, okay. All right, okay. I was going to let you ask them all at once, but Councillor Allen next.
Thank you, convener. Thank you, Mr. Wilson, for the report. On pages 28 and 29, there's lots and lots of examples of things that people complain about. And on pages 33 and 34, where we've got the tables, it talks about the number of complaints, and a significant number of the complaints are not upheld. I wonder if you can elaborate on that and tell me if it's just people wasting our time.
Hi there, thank you for the question. Our upheld rate always tends to be around about the 20%, so that's a trend that we've seen for many years going past. For stage 1 complaints, it's 1 complaint point, so the Ombudsman requires us to either uphold or not uphold those complaint points. For the stage 2s, they're more complex in their nature and are often multiple points. The Ombudsman requires us to take a balanced view of that based on the number. So if it's over 50% upheld, it becomes upheld complaint, not upheld, and not upheld complaint. So there's great value in the stage 2s, and it will be a mixture of the upheld and not upheld. So I wouldn't say that people were wasting our time. We can't obviously stop somebody complaining. They feel passionate about what they're complaining about, and it's up to us to do the response. But yes, a lot of the time we go back to explain the situation and why the customer's not complaining, but what our position is as the council.
Just for my own interest, can you give me an example of something that somebody complains about and you can't uphold it? Thank you.
Thanks for the question. There's lots of complaints that come in that we can't uphold. So we may say that we have dealt with a process that was incorrect, and we go back, look at the process, we evaluate it, and we say we've done exactly what we were expected to do. That could be a repair for a council house, for example, done within the correct timescale, but it's not the expectations of the customer.
Thank you. Councillor Roberts.
Thank you, convener. I was looking at page 39 with a sample of the complaints we get. We can always learn from complaints, but how does the complaint procedure work if there's complaints based on problems within a service? Does that mean that resources are directed to addressing the problem that people are complaining about? And how does that work? If there's a continual complaint about things, can we be assured that that means that there'll be resources directed at that issue and not just put to one side?
Thank you. Yes, the trend analysis, especially with the new dashboards, allows us to pinpoint those areas. So if we are seeing a trend, something that needs to be amended, the service can take that forward. So maybe an amendment to a procedure, for example, or if it's a wider piece of work, they would involve business improvement officers from Greg Boland's area to take a bigger piece of work forward.
Can I just say, I don't remember seeing a report coming from the council saying that we're doing such and such because of the number of complaints been raised about it, or we see a serious problem. It'd be quite good if we actually, for example, I notice there's always complaints about people seeing empty council houses and nothing's to be done with them. But it'd be quite good if we actually saw actual action in reports saying we're doing such and such to address concerns that people have raised with us. I don't think I remember seeing that in many reports. Thank you.
I was going to say that's a comment. Okay, thank you. Councillor Forbes again.
Thanks, convener. Interested in 1.4, it says we're dealing with complaints in a child-friendly manner as required, etc., etc. I wonder, do we get many complaints from children?
Hi there, thank you. Through our education, we get complaints from children. And in the past, they came from the parents of children or the carers. The new SPSO statement for handling complaints takes into account that new legislation, and there's key principles around it being person-centred. So now we take the views of the child and involve the child much more at the start of that process. So this is a new change for this financial year.
Thank you. Councillor Welch.
Thank you, convener. It's actually building on Councillor Robertson's point, which I think is really valid, because ultimately it's a window for us as a council to understand, maybe trends, to get sort of insight into areas of our activities, or officers' activities and staff activities, which are maybe need to have more time invested to identify where some of the issues are. And I guess my question is, how are we capturing those trends and effectively feeding that back into the wider piece? And I've got a second question, if that's okay too. A second question is generally, when a complaint has been made, how are members of the public actually engaging with us as an organisation, and is there any way to sort of do that in different ways that maybe sort of because ultimately in many instances when people are complaining, it's because they're not being heard, and I just wonder if there's more effective ways to allow residents to be heard. Thank you.
Thank you for your questions. The trend analysis, the dashboard, the way it's been built and the information, the services are taking that forward themselves, so they can see the data that's coming in, and by the sentiment of the customers, any trend analysis that's there. So as I said earlier, they would then take that forward. It may be a procedural change or something that's quite straightforward for them to implement right away. If it's a bigger piece of work, they're doing that work with the likes of business improvement officers and program that work out. So some examples in previous would be work that they've done with roads, for example, around the customer journey and redesigning that for it to come, how that work comes in and how we respond to that type of work. In terms of the complaints engagement, a customer can come through the customer service centre, they can do it by email, they can come into the offices or by writing. There's lots of ways that they can come into the process. That is then logged and is allocated to the most appropriate officer. So for frontline resolutions, it's the person who's closest to that work and who we think can respond to that in the shortest amount of time. That may be by a telephone, an email, but the crucial thing is to try to do that within the 5 working days or the 10 if they need slightly longer. If it is more complex, then it would come into the stage 2. My team would speak to the complainant and find out a little bit about the history and then agree what the scoping points are. So the points for complaint that they're then going to take for investigation. That conversation then continues throughout the life cycle of that complaint, keep them in the loop of where they're at with it, what evidence they've got from the council, anything else that the customer can then supply us to help us build that picture and then rule on the individual complaint points.
Thank you. Another question from Councillor Allen.
Thank you again, convener. It just comes back to my point on my previous question about the number of complaints that are upheld. I just wonder if there's any measure of satisfaction over the outcome of our review of complaints. Are people generally happy about the outcomes and the explanations, or do we have an awful lot of disgruntled people out there?
Thank you for the question. We do a sample of the stage 1s that go out to see what people's perception was of the complaints process that they've been through, and we do the same for all stage 2s, and it's mixed results that come back, obviously depending on a person's complaint has been upheld or not upheld, and have they got the outcome that they're looking for. So it is kind of mixed. They are happy with the process itself, they feel that they have been heard and they've had a response, but they're not always 100% happy with the outcome because it's not giving them the desired effect that they were looking for.
Thank you. And Councillor Forbes again.
Yes, thank you, convener. I'm at the bottom of page 28 and it's recurring themes. The 1, 2, 3, 4, the 5 in the middle are all things that have been or could be affected by budget decisions made by us elected members. I'm wondering if the complaints team ever actually find themselves having to say, well, these are political decisions taken in the council chamber by elected members and there simply isn't the money, for example, to keep public toilets open. Do the complaints team ever get to that stage?
Thank you. We wouldn't word it in that way, but we would go back to say what the council's position was in terms of the policy and the procedures.
Thank you. Councillor Massey, you're next.
Thank you, convener. It's a follow-on to one of Councillor Forbes' questions on the UNCRC. And I would like to know what enhancements we've made to comply with the UNCRC child-friendly principles and how do we measure the effectiveness of these changes?
Thank you for the question. We have just changed our literature, our websites, and engaged with the schools and the education on how we expect that a young person to engage with us. So that may be in a school environment, for example. They want a third party there who's not a parent. I can share a document on kind of good guidance that's came in from the Ombudsman, which we have adopted around being person-centred and accessible service, simple and timely, thorough, proportionate, consistent, effective, objective, impartial and fairness when we're dealing with that complaint, what resolutions we can offer, and then how we learn and improve from that complaint.
Thank you. Councillor Shars.
Thank you. My question's around the sort of trend analysis in the data, and I'm presuming the answer to this would be yes, but do we look at the geographical spread of where the complaints come in at any given time, particularly, just to pick an area such as housing, if we're seeing a glut of complaints around a particular, geographic area within Perth and Kinross, and how that's all managed?
Thank you. That's actually a good question. That was something that we put into the dashboard for strategic leads and for the teams under them. When all the complaints come in, either stage 1 or stage 2, they can take it down to geographical area and right down to street, for example. So for housing, using Elaine in her areas, she could see, was it a big refurbishment programme? How many complaints did that generate within those streets?
Is that, thank you for that, and that's really encouraging to know. And then what happens to that afterwards in terms of performance improvements and reporting, etc. And how is that, going back to the comment that Councillor Welsh made, how is that fed back to communities?
Thank you. The way that they're working just now, so taking away as an example, she would analyse that data to see if there was any learning actions from it. So is there something she can learn from the programme of works for that area? Was it what she was expecting to happen with that work? In terms of feedback to the communities, that would be up to the services to feed that kind of information back. So I know, for example, I'm using away this example because I have one in my head, that she has regular meetings with that community over the programme of work that's been taking place, what the expectations are in the short term, the medium term and the long term, to try and get them part of that process early on, and so the expectations are kind of managed and met.
Okay, thank you. Councillor Forbes, I think you wanted to come in with a comment. All right, okay. So are there any more questions? Not seeing any more questions. So yeah, Councillor Forbes, you can come in.
Yeah, thanks, convener. And Mr. Wilson, thank you very much for putting forward a very easy to read report, and also for your ability and willingness to answer all of our questions concisely, which is much appreciated. I'm particularly interested in 5.2. I think that's really good that there are so many service improvements where we're actually listening and we're acting on behalf of the complaints that have come in. I think to use those as a learning process, as was said earlier, is a really good way to handle this. So thank you for that. And convener, if you don't mind me just being a little bit parochial about this, there's no one in the room that can help me with this apart from perhaps the Deputy Chief Executive, although I suspect it's way below her pay grade. But interested to see that One of the responses to a complaint about litter in and around schools added bins, and I just want to say something that for 3 years I've been trying to get an additional bin in Errol Park, and for 6 months I've been trying to get an additional bin in St Meadows, and I'm always told the facility there is not there to support the collection of those bins. So quite surprised to see that one of the things we are able to do as a result of complaint is to put in extra bins, and I'll be using that as ammunition when I go back to that particular service to ask for the 8th time about an additional bin in Errol Park. Thank you.
Thanks. And actually, the Deputy Chief Executive did want to come in, so let him.
Yeah, I'll speak to you later, Councillor Forbes, about those particular issues. I was going to come in earlier on at the back of Councillor Welsh's comments, just to give a bit of a wider context in terms of how we handle complaints within the wider context of all customer insights and customer service information. So you see the report here, and there's very detailed information via the dashboards that go into strategic leads, service managers and team leaders across the organisation. They consider those alongside the elected member inquiries. The information that we're getting through now from elected members is hugely valuable, along with customer service centre information. So we're getting a lot of inquiries coming through the customer service centre. Social media analysis. Lisa Potter's team does some fairly good social media analysis, so that gives us a real sense check of customer insights from a number of different sources. We do, so there's been a few questions this morning round and about service improvements and budgets. What the strategic leads and probably service managers really do focus on is, have we got the resources in the right place? So if we're having repeated complaints or concerns or inquiries about a particular area, have we got the right resources? Or if we're not performing, so performance targets is another area that we will look at within that context to consider whether or not we need to bring in support, as Conor mentioned earlier, from Greg's team in terms of service improvement. I think another point that's really worth mentioning is Alan Taylor, and Conor supports this, holds a fairly regular customer services board. And the team at the moment are reviewing our customer service standards, and I understand that Alan plans to do some engagement. I'm looking behind me at Conor there with elected members in terms of the review to customer service standards. So more on that, but that kind of wider customer insights piece I think is really important, and certainly, you know, from your own point of view, the elected member inquiries, as Councillor Forbes said earlier, it's normally when things go wrong that it hits your desk, and I think that kind of wider information is hugely valuable for us in terms of really understanding what's happening out there and where we need to sort of target resources and improvement.
Thank you. And comment from Councillor Welch.
Really, it's just to thank Mr. Wilson again for a clear and concise report. I think this is an area that is a window into sometimes how we're doing. It's an area that you know, as was raised earlier in terms of supporting staff and you know, and supporting them and the engagement with members of the public and wider is important. But it's good to see it's been done well. It's also good to see that when it's externally assessed, it's also been reviewed and positively marked, if you like. So thanks to Mr. Wilson and his team.
Okay, thank you very much. Just reflecting on one of the points that Councillor Forbes raised, somebody who used to work in quality assurance and dealing with the need to continuously improve. I think the fact that we're actually making 290 service improvements over the year in response to the complaints is a real strength. So thank you to Mr. Wilson for that report and for being here to answer our questions, and thanks as well to the wider complaints team for dealing with those and providing the information that underpins this report, and for doing the work that underpins this report. So I think we have considered this report and commented on it. Can we also note that the performance of the complaints handling procedure will continue to be monitored and reviewed throughout the year? Okay, thank you very much. The next report is Perth and Kinross Child Protection Committee Standards and Quality Report 24-25, and that will be followed by the Perth and Kinross Health and Social Care Partnership Draft Care and Professional Governance Assurance Report. The discussion on both of these items will be led by the Vice Convener.
Thank you, Convener, and good morning, everybody. So in turn, I'd like to hand over, please, to Mr. Singh to introduce the Child Protection Committee Standards and Quality Report for 24-25. Thank you.
Thank you, Vice Convener. The report before members today is the annual Child Protection Committee Standards and Quality Report. Before I go on, I would like to pay thanks to Bill Atkinson, who was for several years the Child Protection Committee's independent chair before retiring in May of this year. And we have our new independent chair, Graham Binney, in chambers today, who will no doubt be playing an active role in future meetings. Turning to the report itself, there is extensive data and analysis provided on the report of our child protection systems more broadly. Members will note that there is a stabilisation in child concern reports and a continued downward trend in formal child protection processes. This reduction is attributed to several factors: the implementation of GERFEC, the promise, innovations that are funded through the Whole Family Wellbeing Fund, and a shift towards early intervention. The Quality Assurance Working Group has closely monitored these trends to ensure that earlier intervention is effective and that children and families continue to receive appropriate support. The report goes on to highlight a structured approach to self-evaluation is now in place, with findings widely shared across the partnership. Recent audits have explored the voices of children and young people in the child protection processes, the implementation of the Safe and Together model, and the effectiveness of IRDs. A multi-agency audit on neglect found strong immediate responses and relationship-based practice, but also identified areas to be strengthened, such as more specific planning and better inclusion of the views of babies and non-verbal children. Efforts to engage the public and families have included redesigning web pages for children and young people and piloting community engagement activities through participation. The Child Protection Committee's governance and subgroup structure remains robust, with strong strategic connections to public protection more broadly. Looking ahead, the Child Protection Committee is committed to strengthening public protection arrangements, enhancing participation, and maintaining a focus on quality assurance and inclusive practice, guided by the principle of protecting children is everybody's responsibility. We have Julie Baker, who is the Interagency Child Protection Coordinator and author of the report in chambers today, and we're happy to take any questions. Thank you.
Thank you very much for the report and the introduction. I see that we have Councillor Robertson with the first question. Please go ahead.
Thank you very much, Steve, for your taking us through the report, which is makes very good reading. Can I ask you what, going forward, wakes you up during the night and you worry about with regard to child protection within Perth and Kinross?
Gosh, that's some question. I mean, I suppose I would say I am fairly confident in terms of the systems and processes that we have in place. I am further reassured by the quality assurance work that the lead officer engages with. I'm also assured in terms of the analysis of data that we undertake to determine where we need to focus learning and development opportunities for our staff if there's any emerging trends, for example, around domestic abuse or exploitation of any description. I think the reality within the field in which I work is that there are no guarantees in terms of bad things happening to children. We as a service can only look to protect and mitigate those factors which we're aware of, and obviously we do our best under those circumstances. But tragedies happen, and you'll see that within the news, and you'll see that within other areas. And I think what's important for us to do is to take learning from those learning reviews that are undertaken, make our workforce aware of those, so that drip effect of kind of knowledge, that kind of, you know, awareness at the front of their mind when they're visiting families, what to look out for, you know, learning from other, as I says, other learning reviews, I think is a really important contributor. So as I says, I am reassured by the work that we do here in Perth and Kinross, and I think we have really good staff. We have really good systems and processes in place. So I'd offer that as my view.
Can I just say, this is really a comment. When I've read the report, I got a strong sense of reassurance as well. But I'm sorry I asked the question, but it's just something, you know, it's always a worry, isn't it? Thank you.
All questions are good questions. I had a similar one, so good question. The next question then to Councillor Allen. Thank you.
Thank you for the report. I enjoyed the report. It's easy to follow, and there's lots and lots of information in there. And also in your last comments there about you think you've got the right people in the right places. I'm going to ask you that next question that's probably impossible to answer, but let's see where it goes. What steps can we take as a council which will allow you to get it right for every child? What's missing?
I think we've got a lot of things right at the moment. I think the council's investment in early intervention, I think, is paying dividends. I think the report highlights that. I think what we can see is that the number of statutory interventions around child protection are coming down. What I would hasten to add is that that does not necessarily mean that we don't still have really complex family situations and dynamics that our workforce are working on. Absolutely, we have. Our case numbers have not declined at all. Our case numbers have remained absolutely steady. But what's changed is the way we're working with families. Child protection can be a very adversarial approach. You can kind of end up kind of butting heads when there's a perception of risk which isn't shared by families. We're now working with families much earlier. We're building relationships with them. We're on common ground to understand where those risks are and what we can do. I think we have really good working relationships broadly as a child protection committee and as a system in terms of working with colleagues in education, working with colleagues in health and with police. I think we need to continue to do what we're doing. I think there is a lot of work that we want to continue to progress around our rates of gender-based violence. Is still high, and it's not just high here in Perth and Kinross, it's high nationally. What do we do in terms of tackling that? I think the implementation of the Safe and Together model, which is reported in the report, has made quite seismic shifts in terms of how we work with women who are subject to domestic abuse, whereas before the onus would have been on women to protect children. Now the onus is actually on the perpetrator in terms of presenting that risk in the first place. So I think we're doing a lot. We can always do more. We can always do better. I think that's a really important question. I think the Child Protection Committee is absolutely pivotal in terms of bringing those partners together to actually look at what's the collective opportunities we've got to actually move the agenda forward. Thank you.
Thank you. And then Councillor Frampton.
Thank you. My question's based on the unborn baby referrals. We had 114 referrals in 2024 that were made, and out of this number, 19 unborn babies were subject to a multi-birth CPPM. In light of the tragic report recently on the death of little Sarah Sharif, who had been on the child protection list from birth and should never have been given to a parent, what mechanisms do we have in place to ensure that nothing like this can happen in Perth and Kinross?
I'm going to hand over to Julie in a second. I mean, I suppose I'm always quite nervous. My hands are sweating whenever I'm asked about giving categorical reassurances. I just can't do that. I'm really sorry. I would love to do that. What we can try and do, obviously, is look to mitigate as much as possible, be absolutely aware in terms of what those risks are, and actually work in an absolutely multi-agency way, because we recognise that risk does not sit with one agency. You know, that there are many agencies that the individual is going to interfaces and have touch points with, and it's important that all of those agencies are on the same page and actually have a well, absolutely the same charged plan in terms of addressing those risks. But Julia, you want to just maybe add in a wee bit there as well in terms of the unborn babies?
Yes, thank you. Thank you for the question, Councillor. I think the question of how we work with unborn babies is something that we've actually been ahead of the curve with in Perth and Kinross for quite a long time. We've had an unborn baby process for over 20 years, which isn't the case actually in other parts of the country. And the reason that we tend to, obviously in higher risk situations, look at unborn babies being on the register is because of the unique vulnerability of babies. Those under one are actually the most likely to die in terms of child abuse. So we have to take those risks very seriously and work with them. So I think we are ahead of the curve. We have an excellent first steps team, pre-birth assessment team that works with babies right from pre-birth up to 6 months to a year. And I suppose just in terms to echo what Aaron was saying is that, we can't give guarantees because unfortunately there always are people who, for whatever reasons it may be, psychopathology, sadism, will seek to hurt children. So we can only work within the systems that we have. And I suppose in terms of the Sarah Sharif case, she was returned to her father, against the advice of social workers, and that's where family courts, for us it would be the children's hearing things, come into play. So there are only so many decisions that are within our control, I guess, as services. There are reasons for that. So I think there are lots of reassurances around our unborn babies, and I think, as we're saying, our services are in a robust position, really, in terms of where we are. But we can't legislate for people that wish to cause their children harm and can be quite secretive and sadistic in that respect, unfortunately.
Thank you.
Okay, thank you. Next question to Councillor Forbes, please.
Thanks, Vice Convener. Probably an easier one. I don't think your palms will sweat with this one, but if I can draw your attention to page 78 of your document and page 73 of the total pack, it's the bit at the bottom I was interested in. I think in summary, my question is the e-learning modules and courses that are referred to there. Do you think they should be compulsory for all education staff?
Hi, thanks for the question. Education actually has a really good uptake in terms of the modules in child protection. I suppose there was the earlier question about what could the council do to, to make that, to minimise risks or to promote child protection a bit further. So I think if there are opportunities to make, child protection modules mandatory probably for all staff, that would be appreciated. I think education staff are really well supported. They've got good child protection officers in schools with lots of additional training. But I suppose if we think of the council more widely, there are, for example, people going into service users' houses if they're there to fix a housing repair or anything like that. And we have had some, really good referrals in the past from, people that are working for the Clerk of Works. But I think a wider knowledge of that across, I think the arrangements in education are pretty good and satisfactory. But I think it's always worth thinking about other parts of our service we might not naturally think of.
Yeah, thanks for that. That was actually a really interesting answer, and it wasn't an area I'd given consideration to. So I think you've really touched on a point that, as a council, we should maybe look at in the future. But can I draw your attention to the last paragraph? And you say response tends to be relatively low. This is to I presume, a consultation event afterwards. I'm going to disagree with the ex-leader of the council because I think we're actually quite good at consulting, or certainly we at least try very hard. What could we do to improve on that?
Sorry, I'm just trying to look for the page that you've referenced, Councillor. Oh, thank you. Oh, yeah. So I think probably in terms of this, it's quite difficult actually, because one of the things that we hear from staff across the partnership is they have something of an email overwhelm. So they obviously have to respond to the urgent emails, and when we look to kind of see how that's settled in for them, it's probably one of the least of their priorities to tell us about that. So we have been thinking about different approaches to get information back from the workforce, and we're trying to involve people in different ways. So, for example, we had a community of practice event in May about the additional child protection risks for children with disabilities and complex needs, and we've just gone back to the participants of that to invite them to come and look at our draft guidance policy and to revisit some of those things. So we're trying to look at different ways to bring people back in and say, it's been some months since that. What did you think of that? Can you help us, build on the work that we're doing and give your views to it? So I think, I don't think there's any easy answers, but I think we'll continue to try different approaches.
Okay, Councillor Shires next, please.
Thank you, Vice Convener. It's really good to see Mr. Binney in the chamber. He's certainly, and this comes to my question, is around the relationships and having the key people around the table has always been a great strength at the Child Protection Committee, at the Children, Young People, Families Partnership that I've sat on for quite a number of years, and really welcome the input of people like Graham over that piece. When you look at when things do go wrong, and the examples from the tragedies that we've seen over the recent years elsewhere, the issues have always been around information sharing and where relationships haven't been as strong as they are here. Given the geography of Perth and Kinross, and indeed of Tayside, and the NHS Tayside and Police Scotland, it's people covering huge areas of land mass where people are often spread out into very rural areas. How are we confident that we do get that information sharing and that the right people have eyes on in these kind of rural areas, and that is that reflected in the data? Do we know whether it's the predominance of issues are in urban areas to rural, or is it generally covered? Is there I think I kind of got a bit lost in my question there, but it's around the relationships, the information sharing, and the geography, and how we make sure that nobody gets lost because they live away up a glen somewhere.
I think that's a really important question, and a question the legal manager and I were actually discussing about last night, which was those kind of reoccurring themes that come from learning reviews. I mean, I think one of the strengths that we do have here within Perth and Kinross is that we have locality teams, and those locality teams are kind of patch-based across Perth and Kinross, and those locality teams are linking directly with the schools that are within those areas, where they're able to kind of pick up any kind of issues or emerging kind of concerns at quite early doors. We also have our centralised child protection team as well, which is based here in Perth and Kinross, but covers the whole area for those families who aren't known to social work. And what we've got through a centralised process is really good working relationships with police and with health, which also then stretch into education as well. And so we do try and ensure, and I think your question, Councillor Shah's, kind of really kind of comes down to kind of relationships with professionals actually, and making sure that as services that we are providing the opportunities for those individuals who are working in localities to come together. And that's going to be one of our kind of key priority areas in terms of our integrated children's services plan moving forward, in terms of how do we ensure that locality approach is further strengthened for us. So I think we're doing some important work around that. I think we need to strengthen that further, but I do think those relationships are there because our communities are small, and our teams who are working in those communities are well known as well.
Sorry, and just to come back, just for reassurance, because I know that the answer will be a positive one. there's obviously pressures on service delivery for NHS Tayside and for Police Scotland as well as for ourselves. And are we confident that the resources in place across all those three agencies that are key to delivery this?
So specifically in terms of kind of child protection, Police Scotland and NHS have dedicated teams who are part of the IRD function, which is the initial referral discussion, and that's a kind of a tripartite or quadripartite discussion if it includes education as well. And ordinarily it'd be the same staff who are having those conversations. So absolutely.
Thank you very much. Councillor Welch next, please.
Thank you, Vice Convener. I've got actually 3 questions, so crack on. Okay. Yeah. So I guess first question is just around trends and positive trends and negative trends, because the world we live in is changing and changing fast. Second one, and it's kind of related to that, in terms of any abilities to use technology to help support that monitoring to identify, both positive change and potentially negative change as an eye, but not in an intrusive way. And the third one, and it's building on Councillor Shire's point, I guess this element of cross collaborative team working. We see sort of great strains, for example, within vulnerable adults, in the age profile of Perth and Kinross. Are there opportunities across teams where they're challenged by the rurality of Perth and Kinross to work together when geographically they're in similar areas, without causing and to improve effectively the overall efficiency and responsiveness if possible? Thank you.
Okay, thank you, Julie. I'm going to probably bring you in terms of the trend data stuff. I suppose just kind of picking up the final point before I hand over to yourself, Julie. In terms of kind of working together, I think one of the areas, I guess, in terms of child protection, but kind of social work more broadly, is the importance of working collaboratively with others who are also engaging with those children and young people as well. And it could also be kind of services from substance misuse as well, if there's kind of, alcohol or drug misuse with families as well. So, I always say to my staff, if you find yourself working alone, then there's something wrong, because it's really important that we're also leveraging kind of our colleagues from health, education and other services as well. In terms of, I'm not sure if you were referring, but I suppose social work and adult social work and justice and substance misuse, they are very specific kind of requirements in terms of legislation, policy and guidance. And I suppose one of the challenges that social work has always had is that we've always been accused of being the jack of all trades and the master of none. And I suppose one of the areas in terms of providing more kind of specialist areas of work was really to allow staff to really get that really broad understanding around those child protection or adult support and protection. But your point is absolutely central in that we do ensure that we are tapping in and engaging with those other services that are working with that family as well. But Julie, do you want to pick up the question about if there's any emerging trends and potential use of kind of AI, although that might be a wee bit more difficult, I think.
Yes, thank you for your question. I think obviously we're in a very fast-paced environment in terms of how AI is impacting on children, young people. I think probably what we've had over recent years is we've had the spread of handheld digital technology with your phone. What's happened with that is obviously the ability of children, young people to take photos of themselves and to share those images. That's obviously a concern for a lot of children, young people, and the impact that has on those children, young people if those images are released further than they would have liked that to happen. So I think AI is very evolving. I think we need to sort of monitor that carefully and think about the impact that it has on children. But I think probably I think we can tend to get excited about AI risks and online risks, but the primary risks, if you like, to children, young people are from within their homes, for the most part. So, we still see that in trends of, the trio of risks of domestic abuse, mental health issues, substance use substance use, sorry, quite hard to say messes this morning, and they always predominate in terms of children on the Child Protection Register. In recent sort of data that was national in Scotland, in terms of learning reviews for children and young people, domestic abuse was in pretty much every one. So I think we need to keep an eye to the new and emerging technologies, but not forget that primary risks are within the home for children most of the time. And that probably extends in terms of digital risks, in terms of how well supervised they are, how interested their parent is in making sure that they have proper supervision online. So I wouldn't like to lose focus on the big three risks, if you like, that are omnipresent and ongoing for children and young people.
Okay, thank you. I think just to clarify, it wasn't so much the AI side of things that, you know, you see, for example, people wearing effectively technology bands, for want of a better word, that can measure many things around sort of health, well-being information, whether it's, you know, quality of your sleep, whether it's, you know, whether you're moving, etc. And it just dawned on me that is that extra piece of insight that's maybe not too intrusive, that maybe gives you that extra you know, bit of data. And then subsequently, if it was appropriate, then that's where, you know, things like AI can then help you kind of analyze that data. So it was more around that sort of piece. But, you know, thank you for your answers, and it's appreciated.
Okay, Councillor Allen, next question, please.
Thank you. This one kind of alludes back to my question earlier on when I spoke about getting it right for every child. One of the best parts of the report for me was the test study, the case study that you've got represented on page 39 of the report, and it's page 84 of our report, where it talks about a case study in Letham Primary School. Now, it's about online safety for children, and it's a cracking little exercise that's been done there. And it looks to me like it's only been done over 3 schools, Our Lady's, Letham and Googlyburn Primary School. Given how powerful that exercise is, and the wee lad that came out with the winning entry, is that something that we've done over all schools? And if not, can we? Thank you.
Oh, thank you. I think that was a really enjoyable piece of work actually for the schools and for myself and my colleagues to look at that. And all of the children's posters were amazing. They were so good. It was actually delightful to see them. We had done it with those 3 schools because that was part of a week of events we were doing up in Letham, based in the hub and within the schools. But it is something we would like to extend further and think about. And I think it's definitely something that, for me, there's a win there that children, you know, maybe spend an hour thinking, drawing, thinking about online safety, safety in real life as well. So it's something we can look to doing in the next year, probably tied up with events that our education colleagues are doing to raise awareness about online harms. We'd probably look to synchronise those so they had greater impact.
Yeah, please go ahead.
Thank you for that. Yeah, I'm just conscious of where we're going with online safety for kids. I think it's prime that we look at everything we can do to help them. As a grandfather of 7 and a 9-year-old, I think it's very important to get to them at this age. Your case study is great, and I'd like to see it transfer right throughout Perth and Kinross to all schools. Thank you.
Okay, thank you. And then question to Councillor Massey.
Thank you, Vice Convener. The Letham engagement test of change had a low turnout. What lessons were learnt from the Letham Engagement Week, and how will future community engagement be improved?
Yes, thank you for your question. I think we did learn a lot through that. I mean, one of the things I think probably we'd initially thought about Letham because we were going to hold the Child Protection Committee there, and that had kind of extended to, you know, could we do things to raise awareness when we were there? How would we engage with local people? But I think probably what we hadn't really considered was the context of how busy Letham is in terms of its initiatives and people that want to come and speak to people from Letham. And I think probably there's a sense that people could think we were coming to let them, because there are particular child protection concern issues. And actually, that wasn't what it was at all. It very much came from a place of strength and knowing that there was a community hub there that we could use to launch some activities. So I think some of the things we learn is that we need to think about how we engage in better ways with people. So we've had discussions at the Child Protection Committee with our colleagues from the libraries and the events they do about whether we could go up there when they're having, sort of events about children's books or, children's events, and see if we can link into some of those. And to link more, I think, with our education colleagues who are planning some seminars probably isn't the correct word, but some events for parents next year on sort of resilience online and online safety, and trying to sort of link in with something that's already happening. I think one of the things we'd considered is that actually Child Protection Committee as a title isn't that engaging really, it probably puts people off. So, I think we need to think about how we do that under probably the auspices of the Children, Young People and Families Partnership, how we link with education and sort of edge our way into events that are already happening more than running them ourselves, I think. I don't know if you would want to add anything, Karen.
Yeah, thank you. I mean, I think one of the realities that we experience is that we do struggle to engage with families around child protection. And I think one of the lessons that we learned from Lethem was having a stall around child protection probably wasn't the smartest move, because who's going to want to rock up to a stall in your local community around child protection? So I think we recognise that maybe that was maybe a wee bit of a step too far. And I think one of the other bits is the reality of society is that child protection is clearly an area of work that people are really quite uncomfortable with, actually, and don't really like to acknowledge that the harm that can be caused to children. But unfortunately, it is a reality that we have to kind of work and serve in every single day. But I think Julie's point is really important, in that I think we need to make child protection accessible. And I think the way we look to do that is make it more meaningful to families. So some of the conversations we've had in chambers here this morning is around online safety. Now, I know that's a genuine concern for many parents. So I think how we badge child protection in the future is potentially going to be a wee bit more important than actually having a child protection. So I think that is a barrier. I don't think there's any doubt about that. But I think it's about tapping into those concerns that parents have, and about extrapolating those and then coming back with a branding that's in keeping with what their concerns are.
Thank you. I think there's inspiration maybe from the recent tourism strategy, isn't there, of helping children to live life well or something like that, that it should be about the positive rather than the negative. But next question to Councillor Smith, please. Thank you.
Thank you very much, Vice Convener, and thank you for the report. I'm just hoping this is a really relative question here, but and I have experienced, not personally, but what response do we do when, for instance, somebody reports a child being abused, etc., and it's false? I mean, how sensitive are we with that? And I can understand how difficult it could be. Way back in the past, I remember a family in another area were accused of it and it was false. So how do we handle that? Thank you.
Yeah, I'm going to pass over to Julie. So Julie's just going to come from kind of frontline experience in terms of how we manage that. I mean, I think what I would say before passing over to Julie is that any concern that we have, we are duty bound to investigate. And I think your point about how we investigate it is really important. And I'll pass over to Julie to maybe just do a deeper dive around that.
Yes, thank you for the question. I think that's really important, because in terms of how we approach a child protection concern, as Aaron said, we absolutely have to take every single one seriously, no matter, if there might be some reason to, be less believing of what's being said. But I think the important approach is something that we've highlighted within the audit activity, which is about relationship-based practice. So some of that is about how we approach families and saying to them, actually, we've had this concern. We need to let you know about it. We need to explore it further with you so that we can satisfy ourselves that, your children and yourself are getting the support you need. And I think it's really a key phrase that's been around in child protection for more than 20 years, which is about respectful uncertainty. So we never know what's happened in any given situation. We always have to go in with being respectful to people, hearing their point of view, and obviously making every attempt we can to be as sympathetic and understanding to people about the allegations that have been made and working them through. But we do need to do it, and people have a right to know what's held about them as well in terms of information. So it's not something that we could ever just ignore in terms of that, or sort of put to bed in any way. I think if we were getting repeatedly malicious concerns, we would look at that and be considering how to respond to that. And in fact, for example, if that was in a situation of post-separation abuse, that might form part of the evidence for one of the parties, in a court case. So it's a delicate area, but I think, again, it's always about treating people with respect and compassion and explaining what our role is, if that makes sense. Is that okay as an answer?
Thank you very much. There being no more questions, let me ask a couple of questions while you all think of your next round of questions. So I'm looking at page 53, and we've got the graph there of CCR child concern reports by source over the last 5 years. One of the trends that's unmistakable there is that the referrals from police have increased by 40 to 50% over that period. I think we've covered this in previous years, but the trend wasn't maybe as apparent maybe 2 years ago when we first sat as this committee. Do we think, is that a sign that, so do we see actually that there is the actual causes for concern and the reality of concern trends with that increase over the years? Or is it just increased vigilance on the part of policing colleagues, which is also a healthy thing? But just interested in knowing whether the actual concerns follow the trend of the causes for concern. Thank you.
Yeah, thank you. I could probably take that. Not speaking for Police Scotland, but having extensive experience of their operations. I think I don't have a concern about the police reporting by default. I think that's positive. I think the criticism could be directed at them if they didn't report those concerns, so that a full picture involving all key services can be made of the situation. I think the difference with policing, why you will see those trends, is that the police aren't equipped at the front line to deal with these situations of distress or trauma or chaos within families. I think education professionals, social work professionals and health professionals are better equipped because that's their core role. So I think we will always see that. I think you will see the police by default reporting more because they're not necessarily equipped for frontline resolution in these areas.
Great, thank you. That's reassuring. I suppose, yeah, it's good that police are bringing extra eyes into the room who are expert in their field, so long may that continue. I had one further question, a more higher level question. So the improvement plan makes for very, very good reading. It's very good to see something coming before us where every red, amber, green, apart from one, is at the green status, and the one that isn't green has been impacted by external forces, i.e. the new 2024 Act. So that's really good news. But my question is, does that mean there's room for further improvement? When do you as a group sit and think about how you can push yourselves further, maybe for next year's improvement plan, in order that you're setting what we might call stretch goals in the business world? Thank you.
Yeah, so the improvement plan's actually based over 3 years, but what we do is I write a progress report every quarter about how we're getting on with that, and we review that at the Child Protection Committee just after it comes out. And every time we do that, we're thinking about what are the new things that are happening. Is there anything that we need to address? So, for example, we added on 2.7, which is about working safely with children and young people in response to a learning review in another part of Scotland about a position of trust case in which a teacher had seriously sexually abused a young person in their care. So we recognised that that was something we wanted to target and add on. So at each point we're thinking, how can we get this better? Do we need to make adjustments each time? So I think over each time it comes back to the committee, we'll be thinking, does it need tweak? Can we add on other ones? So it's dynamic, and it's published. I publish it every 6 months on the website, so it's there rather than quarterly, because I think that probably gives a better sense of progress being made.
Okay, Thank you for the reassurance then. There being no further questions, let me turn over and see if anyone wishes to make comment against the paper. Any members want to make comment? Okay. In that case, it falls to me then to conclude and thank all of the team members and also your teams for the good work you do in this sometimes, I guess, quite distressing area. It's recommended that we scrutinise and comment on the report, and I think we've done a good job of that today, so thank you for all your time, members, and your attention to this. It's further recommended that we note the work being carried out and endorse the content of the report. I think I'm happy to do that. Are others happy to do that? Agreed. Thank you. So we move on next to the final item of today's business, the Perth and Kinross Health and Social Care Partnership Draft Care and Professional Governance Assurance Report. I think again it's you, Mr. Singh, introducing the report. Thank you.
Thank you, Vice Convener. So the report in front of members provides assurance on governance of social work and social care services within the Perth and Kinross Health and Social Care Partnership for the period of August to September 2025. The Care and Professional Governance Forum oversees risk management with regular reviews of operational risks and escalation procedures in place. The current level of assurance is deemed to be reasonable, reflecting general sound systems with some areas for improvement, particularly around occupational therapy capacity, where high demand and staff vacancies are being actively managed through recruitment and prioritisation. During the reporting period, there were no significant issues requiring escalation. The mental health officer team continues to perform strongly, notably achieving a 92.3 completion rate of social circumstances reports, which is well above the national average. Complaints remain low, with 5 received and 12 closed during the period, and most relating to service provision. A small number of complaints were partially upheld, leading to supervisory oversight and direct learning for staff, and there were no complaints that were referred to the Scottish Public Services Ombudsman, and no external inspections took place during this time. 2 large-scale investigations were ongoing in care homes, focusing on staffing and medication administration, and a learning review that was initiated following the sudden death in supported accommodation earlier on this year, with no systemic failings identified, but a reminder issued to service providers around training. Efforts to reduce drug-related deaths include enhancing staffing, new referral pathways, and assertive outreach. The report concludes with a recommendation of reasonable assurance for members, and members will note that this report has changed over the past few committee cycles, focusing specifically on council delegated service to the Health and Social Care Partnership. I hope the report provides assurance to members, and I'm happy to take any feedback on that.
Thank you for the introduction and thank you for the report once again. Councillor Allen, you have the first question.
Thank you, Vice Convener, and thank you again for the report. And it just comes back to your recommendation, your final point there. Reasonable assurance, having read it, I can't disagree with that. Just wondered, do we have an aspiration to move to substantial assurance?
So the services which there's each service on a kind of periodic basis, on an annual basis, will come and provide an annual assurance report to the Care and Professional Governance Forum. I think it's really important that we recognise that some of the services are dealing with some really complex individuals with some really kind of challenging set of circumstances in an environment, I guess, where services, I suppose, are struggling in terms of both service provision. So I suppose the reality within social work and social care is that there are many things that are within our control, but there are other areas for which we have very little control. For example, the availability of service providers in the area. Whilst we have kind of commissioning procedures and protocols in place, if the service availability isn't there within those resources, then it can lead to real tensions in terms of an assessed need not being met. So So services themselves are working really hard and absolutely want to achieve a substantial level of assurance. But I think what happens is that circumstances and availability of resources and legislation changes and all those bits will require improvement, which is why ordinarily it will stand at a reasonable level of assurance, recognising that systems and processes are in place, but tweaks need to be made to further improve that. Does that kind of make sense? Or how about you? Yeah, work towards it, absolutely. Yeah.
Okay, thank you. Councillor Forbes next.
Yeah, thanks, Vice Convener. I appreciate this is about the sort of general assurance issue, but I hope it's okay to ask a couple of specific questions that have jumped out at me. On section 4.4, Aaron, risk number 1 and its lack of OT capacity. I'm kind of aware of this because I've been helping some people with their blue badges, and I was told that the shortage of OTs across the country was having an impact on that. So that leads me to the point that there must be a real shortage of occupational therapists, and therefore I wonder, under the section on mitigation, it says which will include recruitment to vacant posts. I wonder how easy, if at all possible, that's going to be, given that, if I'm right, there is a general shortage of occupational therapists.
I mean, I think it's important for members to be reassured. I mean, I co-chair the Care and Professional Governance Forum, and I suppose in my role as Chief Social Work Officer, and what I do have is the ability to escalate that to the senior management team within the Health and Social Care Partnership. And this was one of those areas that I then took to the senior management team within the Health and Social Care Partnership to seek further reassurance around that. There is, and you're absolutely right, I think if capacity is limited, then we need to what tasks are individuals doing, and can those tasks be done in a different way? So I think one of the virtues that we have within the Health and Social Care Partnership is that we also have OTs who are part of health services as well. So there is currently a transformation programme that's currently being progressed to look at the role of OTs more broadly across both social care, social work and health, to see other opportunities to kind of collaborate and join some of those areas of work better. But I think your central tenet in terms of the recruitment crisis within occupational therapy remains a national issue, and how do we look to do that? There are ways and means in which services can do that, whether or not it's providing opportunities in-house for staff to kind of receive some of those kind of training opportunities to further enhance the roles that they're taking. And I was assured when I attended the SMT that they are absolutely crystal clear that this is an area of priority that they need to put some energy and some traction around.
We've got the convener. Let's go to the convener first and then to you. So go on then. Councillor Forbes, go ahead. Agree amongst yourselves.
Thanks. Of course, now I can't find the question. Here we are. It's just something that piqued my interest, Aaron, and it says 4.5, a short life working group has been set up to review the pathways for arranging transport to hospital of acutely ill patients when Mental Health Act compulsory measures are required. So I guess that would be what in the old days we might call being sectioned, and how do you actually get someone to hospital? I just wondered if you could elaborate on that. Is it something that happens very often, and what was the specific problem and what's the solution?
I would need to go back and refresh my memory. I think the issue was one of when individuals were coming to hospital and they were being placed on general wards, and then they were then being assessed as requiring to be detained, and then ensuring that they were on the appropriate ward that had that level of security and expertise, and about how we made sure that those individuals were being transferred into those new wards that weren't necessarily within the hospital in which they were in. So they might have been going to 9 Wells, for example. And then once that detention had lapsed, or they were considered not to be at risk in terms of mental health, how they then kind of came back. I think it was quite a kind of complex issue, but if you want, I can look into it a bit more and come back to you off table.
It's okay. Do you know, I don't think it's that important for you to spend your time out with the meeting on it. I actually was really querying whether this was connected to the issues with the ambulance service, but I think you've answered that bit of my question, so I don't think you need to do any work. Thank you. But I see there's a comment that someone else is going to say something that just flashed up.
Yeah, Ms. Roger, please feel free to come in.
In case it's helpful, I have been involved in issues relating to this from a legal point of view, and I think one of the issues is simply around which agency has legal authority to transport people to hospital when they've been detained in the community or made subject to a legal order that requires them to be removed. So I am aware that has been an issue that is the subject of ongoing discussion, so it may partly also be about that, Councillor.
Thanks. I think that's answered the question. So no further work required. Thank you.
Okay, thank you very much. And then convener for your question.
Thank you, Vice Convener. It's on that red risk, the lack of OT capacity that Councillor Forbes was asking about. At present, there are 3 occupational therapists employed with a number of vacant posts, and I just wondered how many vacant posts there are, so that we can get a sense of whether that 3 is 75% capacity or whether it's 10% capacity. See what I mean?
I think there were 2 vacant posts that we were looking to recruit to, and I think because of the work of the transformation at the moment, there's I'm not saying yes. So because of the work of the transformation, there were a number of posts in which individuals are acting up in at the moment, and there's other posts which are as part of the transformation program being considered for kind of alternative use, if that makes sense. So, but broadly, I think there were 2 vacancies.
Thanks. So I guess the other part of the question is, there's a consistently high intake of daily referrals by the occupational therapy duty service, an average of 40 referrals daily. I don't know how many referrals an occupational therapist could get through in a day, but I imagine it's nowhere near enough to deal with that number of referrals daily, 40 referrals figure. So I wondered what there must be huge downstream problems that this creates, because if people aren't able to be discharged, or then they will be losing mobility and so on, or if they're not able to be moved into home, they might need a care placement and so on. Does that 40 referrals daily, is that ending up in a huge waiting list of referrals, and what are the further downstream consequences in terms of patient safety or patient ability to live independently, or at least with minimal care intervention?
Yeah, I mean, I think the reality is that we do have waiting lists. What I would say in terms of those kind of 40 referrals that are kind of coming in on a daily basis, there will be of a real spectrum of need. There'll be some, so there'll be some really low level telephone calls that we'll receive, that the staff will, on the duty system, will look to kind of signpost individuals to other areas. There may be kind of small aids or pieces of equipment that individuals can purchase themselves as well, that they will be signposted to as well. But again, we might get some kind of referral in terms of some much more kind of complex needs from other areas, in terms of kind of hospitals, in terms of people who've suffered, whether it's kind of brain injuries or have had kind of significant diagnosis or end of life. Every referral is triaged, is what I would say. So each referral is assessed on its own merit. So we have a prioritisation. Those individuals who require support with personal care issues around incontinence will be prioritised straight away. Those individuals who are end of life as well will also be prioritised as well, and ordinarily paediatric referrals are prioritised as well. So we ensure that our resources that we do have are directed at those who are most in critical need. There is always the risk, I suppose, that those individuals who are placed on the waiting list, that the longer they wait, the longer the need isn't met, then their need increases, and then they kind of escalate higher up. unfortunately, the team do regularly, whether it's on a monthly basis, contact everybody who's on the waiting list just to see if there has been a change of circumstances as well. So they are trying to do their best with the available resources that they do have.
Okay, thank you. There being no questions then, I'll turn over in case anyone has a comment against the paper. In that case, we are asked to whether we agree with the recommendation of a reasonable assurance. Agreed. Thank you very much. So I'll hand back over to convener to close out the meeting.
Thank you very much, Vice Convener. Thanks to all of the officers and members of the ALIOs that have come along today to answer our questions, and thanks to all members for participating. I was speculating with the clerk how long we would be today and thought 2 hours, and we've actually come in at 1 hour and 45 minutes. So I think we've covered a huge amount of ground, but we must have been doing it with nice, concise questions and answers. So thanks again to all officers and all members for participating today.